Assalamu alaikum. Welcome to another video. In the previous videos, we were talking about P waves, abnormal P waves, and cardiac conduction. One thing which I forgot to tell was atrial fibrillation, where P waves will not be there. Instead, we will be having an undulating basal line, where the basal line will be similar to this, and QRS complexes will be formed at a irregular rhythm. But I thought we'll make another video comparing atrial fibrillation with atrial flutter. In the last video, we talked about SA node, which gives impulses to AV node, which gives to bundle of His, then to right and left bundles. Now, SA node has a capability of firing impulses at a rate of 60 to 100 beats per minute. This is the reason why we have a normal rate of 60 to 100 beats. If SA node is not working, it's blocked, then AV node takes up the job of firing impulses. But what will be the rate? His capability is only 40 to 55 beats per minute, or some books say 40 to 60 beats per minute. What is the capability of bundle of His or Purkinje fibers or left or right bundles? They have even lesser capability, that is 25 to 40 beats per minute. Now what we'll be covering in this video will be SA nodal block. Here we'll be talking on two topics, that is sinus pause and sinus arrest. So coming to sinus pause, here we'll have a normal rhythm, but suddenly there's going to be a drop in QRS complex. But similar thing can happen when there is an ectopic or premature or extra systole or the same. In that case, we'll have a compensatory pause which will mimic the same. How to differentiate from a compensatory pause and a sinus pause? In sinus pause or sinus arrest also, the preceding QRS complex will be a normal QRS complex, whereas in a premature beat will be coming slightly before this. Like we were expecting QRS complex at the rate of whatever is going on, but if this QRS complex were to hit over here at this area prematurely, that is extra systole or ectopic beat, then there will be a compensatory pause for the next QRS complex which were to come over here. That is a different case which we will be discussing later. Here we are having a normal rate of QRS complex which is going, and suddenly there is a drop in QRS complex, and then the sinus QRS complex forms again. Now only difference between sinus pause and arrest is this duration. If the duration is less than 3 seconds, that is the duration of pause is less than 3 seconds, we can say it's sinus pause. And if it is more than 3 seconds, then it will be sinus arrest. Some books say 2 seconds. If it is less than 2 seconds, it will be sinus pause. If it is more than 2 seconds, it will be sinus arrest. Now one more thing I just want to say, that if SA node does not function after going into arrest, like if it goes into sinus arrest and then SA node is not functioning, then who will take care of it? Then AV node has to take care of it. Then we will not have a similar QRS complexes formed after it. It will be a junctional rhythm because SA node is not functioning. This is some case. This is not the usual case of sinus pause. I'm telling, if sinus arrest follows and then SA node is not functioning, in that case AV node will take up the pacemaking, and we'll have a junctional rhythm where P will be either inverted, or you may not see P wave because it will be inside QRS complex, or you may say inverted P after QRS also. It may continue as junctional rhythm, or it may either fall back to SA nodal rhythm. So it can go either of the two. it depends upon the condition of SA node. So here we have an example of sinus pause, where we have a normal QRS complexes at a regular interval, and suddenly there's a drop in the whole PQRS complexes, and then PQRS restarts again and follows a sinus rhythm. This is an example of sinus pause. So here's another example where the pause is more than 3 seconds. If you see over here, it's written 3.52 seconds. So it's very similar to sinus pause, but if it is more than 3 seconds, then we'll name it as sinus arrest. So this is an example of sinus arrest. So this is an example of sinus pause and then followed by junctional rhythm. I was telling about sinus pause, and then if SA node fails to conduct electrical impulses, then AV node becomes the pacemaker. In that case, we'll have a junctional rhythm where we'll have P inverted, or we may have it inside QRS complex. In that case, we'll not have a P wave, or sometimes after the QRS complex, P wave will be there, inverted. So this is a different case. We'll be talking about that in another video. One more thing I want to tell was the compensatory pause of an extrasystole, or the premature beat. So here is a premature beat which is happening prematurely before, like the QRS complex were to be formed over here, but we have a premature beat, and followed that we have a compensatory pause. This is a different case. We'll be talking about this also later. So by this end of this video, we learned only two things, that is sinus pause and sinus arrest. In the next video, we'll talk about AV block, where there will be first degree, second degree and third degree blocks. In the second degree, there will be Mobitz 1 and Mobitz 2. Hope everyone must have understood. If there is any queries, please comment them in the comment section, and also please subscribe to my videos. Thank you.